Hello, my name is Rob Orr, clinical myotherapist and credentialed McKenzie therapist in mechanical diagnosis and therapy. Welcome to my consultation room. I just want to do a demonstration today of a mobilisation technique for the upper thoracic spine, which is the upper back area, and the lower cervical spine, which is the lower neck area, where they come together. This area can get very stiff, and it's known as the transitional zone or the junction. And I just want to demonstrate a technique right now on a patient that is a very gentle mobilisation technique to free up the vertebrae, to try and get it moving more efficiently. So prior to this treatment, I tested my patient with neck movements and felt the vertebrae, and it was quite stiff in certain regions, especially the lower neck and where the upper back meets. So this is once again a gentle technique called mobilisation, and it's just part of the whole treatment cycle. So prior to this, I loosened off the soft tissue and muscles around the area just to make it a bit more pliable and less rigid. And then this is now an adjunct to the treatment to get the vertebrae moving. And after this, I'll probably do some dry needling on those muscles around the area to even encourage more movement. And then I'll give my patient a very simple exercise to take home and do. So I'll demonstrate this now. So my patient's laying down on their front, and I'll take my mask off just so nothing's muffled so you can hear me. And I feel basically certain parts of the spine. This is what we call a T3 zone. And then I go up to a T2 zone. And then I go up to a T1 zone. And then I place one thumb over the area and my other palm goes directly over my thumb. And then very gently I engage this part of the vertebrae by pushing it very gently. It's a very gentle procedure. And I push until I feel a counter or resistance. And then I take about 30% of force off and then apply the same movement. So we call this a PA mobilisation, posterior to anterior. And then I back off 30% once again and I push on the vertebrae. And I repeat the cycle until I feel that segment start to move and have a bit of spring behind it. Once I feel the movement and spring, then I move on to the next segment. And at any stage, if it's too uncomfortable, or there's anything we call a radicular pain or sensation that radiates into the arm or the shoulder, my patient here will tell me immediately. And if it's not uncomfortable, then my patient just stays nice and relaxed. So I'm going to do a few more of these mobs and until I feel increased movement in this area, and then I'll move on to the next segment. And I'm just going to call my patient Patient X, so no names are mentioned. So Patient X, if you feel it's too uncomfortable or any pain that radiates anywhere where you're not happy with the procedure, you just let me know. Excellent. So my patient just gave me a gentle nod then to let me know that he's heard what I've said. So as I'm pushing on this segment of the vertebrae, I can feel a little bit more movement occurring, which is lovely. And when I feel a bit more spring in the area, so it springs back at me, then I move on to the next segment. If you do hear a dog bark in the background, we're a very dog-friendly chemist. So we welcome the dogs into the chemist because it's a big concrete floor. So if you are coming down to chat to me or chat to the pharmacist at 473/475 Lygon Street in Brunswick East, Health Save Everyday Pharmacy on Lygon, bring your dog in, not a problem. And we've got a watering bowl here and everything. So what I can feel now is that segment moving. So I'm going to get off it now and then I move on to the next segment. Now I'm at the neck area, just the base of the neck called C7. I changed my procedure a little bit differently. I have two thumbs on the area now because it's maybe not as robust as the upper thoracic spine. And I let my patient know, Patient X, if it's too uncomfortable or anything that radiates into your arm or the shoulder blade below your elbow, you just let me know, okay? And I stop the procedure straight away and ask questions. So what I'm feeling now is very gentle movement, which I'm very happy with. Very happy with. So freeing up the vertebrae below has really actually helped free up the vertebrae above. So I now get off the next segment and I walk my fingers to the next level. And once again, I let my patient know if it's uncomfortable or pain radiates, you just tell me and we stop the procedure immediately. And gently pushing on that vertebrae to move it. So you probably can't exactly see what I'm doing, but my thumbs are over the vertebrae and I'm doing gentle movement, very passive. Once again, I push gently till I feel the movement, and if it's stiff, I feel it to a counter resist. I do not push through it, I back off 30% and I carry on the procedure. So this patient presented with a very stiff neck with certain movements that I tested earlier, and with discomfort on the left and the right, more the right. But on questioning, my patient said he experienced some shooting sharp pain on the left, and he drew a line with his finger. So it followed a line of distribution. So we can probably safely say that's radicular coming from the neck. And when we were doing some active retractions, which you can clearly go to my YouTube site via my website, and you can see cervical retraction as an exercise, that was bringing on the patient's discomfort. And as we're doing more retractions, the patient got better on the left-hand side. The right-hand side did get better, but it didn't resolve. Hence, we've got my patient on the table now doing the movement to try and get more movement through that area. I've just adjusted my fingers as we're talking to go to the next segment. And once again, I tell my patient if it's too uncomfortable or you get any discomfort that shoots anywhere or goes anywhere besides my fingers are, you let me know immediately. I stop the procedure. I ask a couple of questions to make sure it's still safe to proceed, which most of the time it is, but we don't have any risk, do we? Any risk at all. So once again, that's called a joint mobilisation. I'm just going to get my little model and show you. So effectively what I'm doing, that's the vertebrae, and this is the patient lying down, and my finger's on here, and I'm just gently see that gentle movement, very subtle movement, just to get it moving. And sometimes that's all we need, is very, very subtle, gentle movements to get more movement. And after this procedure, I'm going to do some dry kneading on the surrounding soft tissue and myofascia to even try and help free up more movement in this area. And then I'll give my patient a corrective exercise called cervical retractions. And why do I choose this exercise? Because I tested it earlier on and my patient got better, not just with discomfort, but also better with movement, and also better when we retested other movements in that area. And I'm going to show you now a cervical retraction. So I'm on the floor and I've got my head looking straight ahead. And I'm going to retract my neck all the way back. All the way back. And I don't push through pain. It goes for resistance. And I come all the way back. And then and to progress this exercise, I retract, I'm comfortable, 2 fingers on the chin, and I push, 1, 2. I retract, I'm comfortable, I push, 1, 2. And I do about 15 of those in a row, multiple times per day. And that will encourage, once again, more movement. So effectively, as I draw my chin back, I'm moving the vertebrae back, and if I'm comfortable, I give a gentle push, 1, 2, to encourage more movement. I'm just going to move the model closer so you can see. So as I pull my chin in like a turtle, like so, and I'm comfortable, I give a little push, 1, 2. As you can see, we're encouraging beautiful movement through this area to free up the neck. If you do have any questions about the procedure, or if you'd like to come have a chat at any time, come down and see me at HealthSave Everyday Pharmacy on Logan Street, 473/475. It's a big blue pharmacy, you can't miss it. I offer a 20-minute complimentary session as well, just to make sure that I'm the right person for you to see. And I've been practicing for 19 years, and I've been studying the human body for 26 years, and I never stop because I love learning. I specialise in diagnostics. I also lecture and teach at Victoria University, so I should be able to help you out. And if I can't, I won't waste your time, and I'll refer you to someone that could help you out. But I do get quite good results, as I do ask a lot of questions and I do investigate you very thoroughly. Thank you very much for your time. You have a nice day. Thank you.